Welcome to the Nonprofit Report, your update on nonprofit organizations, issues, and leaders. I'm your host, Mark Oppenheim, and today I'm delighted to have with me the Chief Executive and the Chief Operating Officer of Native Health in Phoenix, Arizona. This is Walter Murillo, Chief Executive Officer, and Deanna Sangster, Chief Operating Officer. Thank you both for joining us, and I'm so excited to be here, in part because I find it incredible how ignorant I am about some of the issues that you deal with every single day. And, part of it is that I'm not in Phoenix. Part of it is that I don't benefit from your services. But talk to us a little bit, Walter, about the scope of demand and the scope of services that you provide to the community, because they're so very important. And you can do things that other organizations cannot do, and you can serve constituents that other organizations cannot serve as well as Native Health does.
Sure. Just, to put a place setting here is that we are an urban Indian health organization, and we receive funding from the Indian Health Service and some others, but our primary focus is serving the American Indian Alaska Native population of Phoenix in terms of healthcare. I could say primary healthcare, that's true, but there's a lot of things that we do. Phoenix in particular is a unique city in that we are the third largest urban Indian population in the country. And estimates of Indian population range from 90,000 to 120,000. And I believe the characteristics of Native Americans in Phoenix in particular are that of really being transient, of coming here for economic opportunities, educational opportunities, and an opportunity to advance themselves from wherever they're from, whether it's from rural America, a reservation, or other towns. Phoenix is a great hub, is a great place for American Indians, Alaska Natives to live. That being said, Native Health provides primary health care and other health services, behavioral health services, dental, and others for Native Americans that are here, fulfilling the unique relationship of the federal government to provide health care to American Indians and Alaska Natives. So we see that as our role as an advocate, as a medical provider, and as a resource for American Indians living here in town in Phoenix.
Now, having worked with a number of different tribal organizations and Native Arts and Cultures Foundation and several other organizations, Deanna, one of the things that I find fascinating about what Walter was talking about is that you're drawing people from a whole bunch of different tribal communities with different traditions. There are different histories and different linguistic traditions, cultural traditions that are now assembled in one area, in one urban setting, with very common challenges within that setting. And of course, part of what has happened is that the history of interactions has created out of diverse peoples also one identity as well, that of a Native American person. So talk about how you encounter people from these different areas, different circumstances, some growing up in Phoenix in the urban setting, some coming to Phoenix looking for jobs and economic opportunity or for other reasons, but coming in from other places. How do you encounter the populations that you serve, and what does that first interaction look like?
We welcome everyone. We don't treat anybody any differently. I know that with our different tribal members and stuff they have different cultures, different languages and stuff like that, but we don't treat anybody any different. We all look like we're one tribe, you can say. And we just ask, some of the things that we ask for is like tribal enrollment, so that we know what kind of services they're able to get, or we can waive some of the fees that we may have. But I feel like for all tribal members, when there's an urban Indian healthcare center like ours and we go above and beyond for them, they're able to feel more comfortable and more at home, especially when they see other Native Americans working in the facility, whether they're a provider or maybe a front desk person. They feel more comfortable and have the trust is a little bit more in our organization. So we do what we can for everybody that comes, that presents. Doesn't matter if they're Native or not, or if they're enrolled or not, but we do recognize that everybody is different from different areas. Some people are from further away from their reservations or their hometowns. Like sometimes we get people from Montana or different areas like that. And then we do have like 22 tribes, I think, in Arizona. So we do serve probably members of all of those tribes.
Forgive my ignorance. When people come to you, have they come from circumstances in which when they have looked for health care, that they have not been treated the way I would be treated?
Well, I think that American Indians accessing healthcare, especially those that are around an Indian Health Service facility, a tribal facility, or an urban facility, are used to all-encompassing, accessible healthcare. And when you're moving away from, your home, you're not just moving away from your centralized family support. You're moving into an area where you're unfamiliar with your access to resources. And having grown up in a all-encompassing health system, the idea of using how to use private insurance, how to do referrals of copays and deductibles are all new. I think to many of our folks coming, whether they have private insurance or state Medicaid coverage or not, I think understanding and learning how to maneuver within the broader health system is a real issue for American Indians, Alaska Natives that move to town if they're not already here. So we try and help them navigate that to access their company insurance or access state Medicaid or Medicare if they're senior or disabled. So part of that work that we do is to get them used to the broader health system, because it can be scary if you don't know that you go to the doctor next door, but now all of a sudden you have a portion that you're going to have to pay, and the understanding of how to access healthcare through referral or self-referral, what a PPO is, what an HMO is. It's a lot to learn. It's a lot of acronyms, it's a lot of systems, and it's a lot of could potentially be a lot of money. So our job is to help folks live in not just us as a healthcare provider, but also within the broader health system of the U.S.
So that's very interesting to me, because it's not dissimilar to my own experience when I go. I've traveled and lived in a lot of different countries, and each time you really do you have expertise within your environment. You really do have a lot of expertise. You're not conscious of it, and then you move to a different environment and you leave that expertise behind, and you have to. I was completely ignorant that would be a factor, but it sounds like it's a major service that you provide. So you're basically helping people to navigate a completely different circumstance as part of your role. So you have people who help in that.
Yes, absolutely. Our whole system is designed to provide access, primarily access, and we offer direct services as well. But when we work with our partners, we're about 1.5 miles away from a large Indian Health Service facility, and there's many tribal facilities around the city, and they're all partners. And our unique kind of individual or our common mission is to provide health care for the American Indians, Alaska Natives. What makes us a little bit unique is that we operate as a community health center as well. So we find ourselves visited by other populations, maybe immigrant populations, maybe other underserved, underinsured communities around town. And I think, our service and our commitment to the individual shows even when we're serving non-Native Americans.
So talk about the range of services. Before we got on, you Walter, talked a little bit about not only the medical services you provide, the direct physical health services, but there are mental health issues. There are also issues of people who have other needs that also affect their health. Just if you could unpack to us the full range of services that you provide, I'd be grateful.
Sure, I could probably speak to our outreach and other services, and Deanna to our internal services. So one of the things about working in a community is to develop trust within the community, and that means being there. That means participating at schools. participating in outreach events, public events here, Native American events like powwows or rodeos, um, festivals that various tribes might have around town, especially Native American Recognition Days, which is a big month or 2 long event in the city of Phoenix and across the state of Arizona. So we have an open house that day in which we see 5,000 or 6,000 people at our central facility. We participate in the parade. And part of this then is to let people understand that we're accessible and that we're here, and that once they access us, they can trust us to be a part of the system of healthcare that they depend on. So those outreach, those non-clinical things that we do include nutrition, things that for early childhood education. We think literacy is very important. And then we try to combine them in things like our garden. So we have a community garden in which we grow produce, vegetables, and fruits, and they are native to the Southwest. Even though it's an irrigated lot, we have the ability to grow squash and corn and other things within Native American within the Southwest, and we use those in our programs. We use blue corn quite a bit in our social media for recipe preparation and for our classes. But so our services aren't just clinical, but they also extend out in the community. And the purpose of those is not just to expand healthcare, but to build trust.
In our clinics, we currently provide primary care health services. In our medical clinic, we have pediatric. We also have prenatal services that we provide in collaboration with Valleywise.
So prenatal, pediatric.
Pediatrics.
Right? Do you provide gynecological and those kinds of services as well?
Yes, we have all primary care services for women's health. We also have an integrated behavioral health consultant in our clinics who assist with any kind of issues that somebody might come about. Then we have events that we do periodically, like right now we're focusing on back to school. So we do have physicals and immunization events. Either we stay open later, we have different times, or we sometimes have events out in the community as well.
Do you provide the whole range of services from very young to very old to very old people? And do you find that there are different generationally defined requirements? I'm not just talking about, I'm older than an 8-year-old child and I might need different kinds of services, but I'm talking about in terms of how you need to organize to supply services to the young folk who are Native versus their older grandparents.
Yes, we do what we can to accommodate all of our patients. We're constantly looking at different things like software programs to assist us with language barriers. And then even just the materials that we provide, we look at how are we stating certain things, and then a lot of our marketing, we have to remember the whole age range from the younger generation to the older ones as well. I mean, things are different nowadays, whereas the younger generation grow up on laptops and computers and phones, but the older generation has more difficulty sometimes, and we're kind of finding that out with a software program that we've implemented to help with our patients to do registration in advance. So, but we do what we can to assist anybody who has difficulties, who may not be as technologically savvy as somebody else who has these items at their disposal. So we do what we can to help them. So yeah, we accommodate. We're constantly changing to meet the needs of our patients.
I would point out that we have 3 locations right now across the valley, in Mesa, in Central Phoenix, and in West Phoenix, and even the variance amongst the locations that you mentioned. For example, our West Valley Clinic has a large adult and older population, so we'll have internal medicine available to them. Whereas our Mesa and Central, we try to have a pediatrician or pediatric services focused there as well. So yeah, each clinic has its own sort of community that they represent, and the different needs that those communities may have as well. So we try to be responsive, not just as as a whole, but also within the individual geographic communities that we serve.
Now, you have a lot of different competencies, a lot of different medical competencies. You have the physical health elements, and Deanna, you cited as several different disciplines within that physical health area. You have mental health, which includes substance use disorder and those kinds of issues. So that's a whole another set of competencies. Dental services, totally distinct. I don't see vision, so I take it you don't do vision, in your umbrella, or do you do referrals? How does that work?
Currently, we're doing referrals, but we are looking to add optometry at 2 of our locations, and we're still building out at our Mesa location, which will have the optometry there.
And Walter, I noticed that you also do transportation. You have your mobile healthcare unit. So are you basically centered in Maricopa and then Mesa and mostly those urban centers? Or do you also go beyond that? Or is your logistical side more to cover just the urban areas of Arizona?
Right. We are in, I believe, something like the 3rd or 4th largest county in America, Maricopa County. And our charge really that we see is to serve all American Indians and Alaska Natives who don't live on a reservation. There's many in the county and adjacent to the county, which still leaves a very large geographic area, and a very large population. So yes, part of our work in the community includes our mobile unit. They set up at schools. Deanna mentioned that right now we're looking at back to school drives for school physicals, sports physicals, immunization updates, and part of that we keep our clinic open extended hours and days, but we also have the mobile unit that we can send out. We've used that mobile unit in reservation communities, but those are communities that are within Maricopa County or immediately adjacent. We served a local tribal community for behavioral health for nearly a decade. And, we look to work with and partner with other tribes in Maricopa County or adjacent to Maricopa County for services as well. So we'll go wherever we're asked to go. And we always, at our core, serve our Phoenix population as well.
The other thing that I think is really interesting is that if you look at preventive care, you seem to have within your DNA a lot of preventive elements built in. You seem to build community quite well. You have a YouTube channel. You've got various community events. You have your Native Talk programs and so on. So this whole idea, the Young Chefs program, right? I mean, this idea of creating this sort of healthy lifestyle and actually communicating about how traditions could be advanced and also health could be advanced simultaneously, this idea of a positive sense of self, that seems to be part and parcel of how you have developed the organization. Could you talk a little bit about how you listen to the community and respond to community needs so that you're not just, look, money can only be spent once, right? If you spend it here, you're not spending it there. How do you make sure, Walter, that you're balanced so that you're funding these various activities, some of it volunteer, I'm sure, but it always comes back to community health writ large?
Well, I think that goes back to our roots. We started off as a very small organization, and we didn't offer necessarily direct services. Our prime core has always been advocacy as a community-oriented board that we had, and that advocacy led into direct services. So our initial services were WIC and community health nursing, and they weren't necessarily clinical. So as we have grown, we are responsive to what our staff and what our board, which is a community-based board, feel is the need. And as we hear from them through community surveys, through needs assessments, and through our own lived experiences, we find out what we might need. And we understand if we can start attaching those needs and service needs to our operations, and that's a difficult thing sometimes, because sometimes you have to say no, and sometimes you can expand your services. Deanna mentioned optometry. We'll soon have podiatry and be opening pharmacies as well in our latest expansion.
Deanna, you're providing so many different services to your constituents. If there's one thing that you would like to provide, if there's one thing you'd like to improve or change that would have the maximal impact to the people who benefit from Native Health services, what would that thing be?
It probably would be to bring back Medicaid services like we did during COVID, where nobody got kicked off of Medicaid, because we would be able to serve. And I think our patients, we would serve so many patients who don't have the means to pay for anything, and just be able to provide and continue to enhance the services that we currently provide.
How many people would that affect if we're talking real numbers of people who ended up getting kicked off during, after COVID versus during COVID?
I don't know the exact numbers, but it was significant. And we are working hard to get a lot of those patients back on Medicaid. But now we have the difficulty of some of our patients who are afraid to apply for Medicaid due to the ICE, and they're afraid that they're going to be reported to ICE or to be deported. So that's a really big challenge. We're working with some of our patients right now.
Thank you for bringing that to our attention. Walter, if you were going to make one change to improve services for Native Health writ large and to improve Native Health in Arizona, what would that service improvement be?
Well, I think along the lines of healthcare, I wanted to talk about a very large thing that's really not addressed, and that's housing. Housing is a problem both for wellness and disease prevention, but it's also a workforce problem. Whether you're on a reservation or in the middle of a booming town like Phoenix, we have folks that find it very hard to be able to afford living around our central site, because the cost of housing has gotten very, very expensive, and the support programs for housing tend to not serve the working poor to the extent that someone can be employed and also have housing. And so we see that with our patients. If they had the ability to be stable in housing, they would be healthier. Their kids could learn more and be stable within school, and also be employed in an area that is very close to them, that is in high need of their talents and skills. So if there's anything that I could expand our reach into, and that would be housing.
You're both making such important points. It's the interconnectedness of these different elements. It's housing, it's living circumstances, feeling part of the community. It's being able to serve across generations. It's mental health, it's physical health, it's dentistry, it's food, it's employment. All are part of community health, right, Walter?
That's right. And I think that, if you're hungry, you're not going to pay attention. You're going to be sicker. If you long term, the greatest disease that ultimately we're fighting is generational poverty. If we can attack those issues, teen pregnancy, housing, nutrition, and literacy, along with what we do, then in theory, in the long term, it would make our health provisions less necessary. But we're in a crisis in Indian country, and I think lack of those social determinant things feed into the necessity of having direct care and a broader range and greater resource for direct care. So that's the situation that we're in.
This has been a wonderful, wonderful show. Thank you so much for helping me to learn about your services and helping our audiences to learn about Native Health in Phoenix, Arizona. Walter Murillo, Chief Executive Officer, Deanna Sangster, Chief Operating Officer. Thank you so much for your insights. Thank you for sharing your knowledge with us. Please thank your staff, your donors, your funders, the tribal governments and tribal organizations who are your partners and your other health partners across the great state of Arizona. It is just wonderful to have you here, and thank you so much.
Thank you, Mark.
Thank you.